Early critical symptoms of colon cancer that should not be ignored. Colon cancer rates are increasing, and the group most affected by this is not just the elderly, but increasingly the young as well. Excessive stress and consumption of packaged foods, undercooked meat and offal are the main reasons for this. Today we will explore this alarming disease and provide you with important information and signals that, if caught early, will save lives. What is colon cancer? Colon cancer is a type of cancer that develops in the colon or rectum. The colon and rectum together make up the large intestine and are responsible for storing and expelling waste material during digestion. Colon cancer typically begins with abnormal growth of intestinal cells, which can eventually develop into cancerous tumors. In its early stages, colon cancer often does not cause symptoms and may remain silent. However, as the disease progresses, symptoms may manifest. Symptoms of colon cancer. Symptoms of colon cancer can vary from person to person and are often associated with other intestinal issues. Common symptoms of colon cancer include 1. Diarrhea or constipation. 2. Stools with blood or rectal bleeding. 3. Persistent abdominal pain, cramps or discomfort. 4. Changes in bowel habits, prolonged constipation or diarrhea. 5. Loss of appetite. 6. Sudden weight loss. 7. Fatigue or weakness. Diagnosis of colon cancer. Colon cancer is typically diagnosed through the following tests. 1. Colonoscopy, a procedure where a doctor examines the inside of the colon using a flexible tube, colonoscope, to visually inspect the entire colon. 2. Fecal occult blood test, FOBT, examination of a stool sample to check for hidden blood in the intestine. 3. Imaging tests like computerized tomography, CT scans or MRI scans may be used to assess the spread or metastasis of cancer. Biopsy, confirmation of cancer diagnosis by examining a tissue sample taken during colonoscopy or another procedure. Treatment of colon cancer. The treatment of colon cancer depends on the stage, extent, and overall health of the patient. Treatment options may include 1. Surgery, removal of cancerous tissue. 2. Chemotherapy, use of drugs to kill cancer cells. 3. Radiation therapy, use of high-energy rays targeted at cancer cells. 4. Targeted therapies, use of drugs that target specific vulnerabilities of cancer cells. Early diagnosis and treatment can significantly improve the survival rates of colon cancer patients. Therefore, regular screening tests and prompt attention to symptoms are important. Colon cancer can often be prevented through healthy lifestyle choices. A balanced diet, regular exercise, avoiding smoking, and limiting alcohol consumption can help reduce the risk of colon cancer. Remember, it's important to consult a healthcare professional if you experience any symptoms or concerns. Early diagnosis can contribute to effective treatment of serious conditions like colon cancer. Symptoms of colon cancer may include 1. Changes in bowel habits. Colon cancer often leads to noticeable changes in bowel habits such as 1. Persistent diarrhea or constipation. 2. Blood in the stool or rectal bleeding. 3. Thin stools or difficulty in passing stool. 1. Abdominal pain and discomfort. Colon cancer can sometimes cause abdominal pain or discomfort. 1. This pain is often crampy or persistent. 2. Unexplained weight loss and loss of appetite. Individuals with colon cancer may experience unexpected weight loss or loss of appetite. 3. Fatigue and weakness. Colon cancer can affect normal body functions and lead to chronic fatigue or weakness. 4. Symptoms of anemia. People with colon cancer may show signs of anemia, iron deficiency due to blood loss. 4. Symptoms can include pallor, fatigue, and shortness of breath. 5. Feeling of mass or tumor. There may be a sense of a grown mass or tumor in the abdominal area. 6. Groin pain or discomfort. In some cases, symptoms of colon cancer may manifest as pain or discomfort in the groin area. Symptoms of colon cancer typically become more pronounced as the disease advances. However, in the early stages, symptoms may be minimal or absent. Therefore, it's important for individuals at risk to undergo regular colon cancer screenings and consult a healthcare professional if any suspicious symptoms arise. Colon cancer is more frequently observed in older age groups, typically affecting individuals over the age of 50. However, there has been a concerning rise in colon cancer cases among younger adults in recent years. Specifically, individuals aged 45 and above are at higher risk for colon cancer. What are the foods that trigger colon cancer and should not be consumed? 1. Red and processed meats. Excessive consumption of red meats and processed meats can increase the risk of colon cancer. 1. Avoiding processed meats like sausages, salami, and ham is recommended. 2. Ultra-processed foods. Consumption of ready-to-eat packaged foods, fast food items, and snacks can contribute to the risk of colon cancer due to harmful additives and preservatives. 3. Sugary beverages and sugar. Consuming large amounts of sugar and sugary beverages can contribute to obesity, which is linked to an increased risk of colon cancer. 4. Fried foods. Eating foods that are fried at high temperatures can lead to the formation of carcinogenic compounds. 5. Low-fiber diet. A diet low in fiber can increase the risk of colon cancer. 5. Consuming fiber-rich foods helps maintain digestive health and reduces the risk of colon cancer. 6. Alcohol and tobacco. Alcohol consumption and smoking are known to increase the risk of colon cancer. 6. It's important to avoid or limit alcohol and tobacco use. How is a colon cancer placed? 1. Evaluation of symptoms. Colon cancer symptoms typically include changes in bowel habits, abdominal pain, weight loss, blood in the stool, or dark stools. 1. The doctor will assess the patient's symptoms in detail. 2. Physical examination. The doctor will perform a physical examination focusing on the abdomen and other relevant areas to check for signs of colon cancer. 3. Colonoscopy. Colonoscopy is often the most definitive diagnostic method for colon cancer. 3. During this procedure, a thin, flexible tube called a colonoscope is inserted through the anus to examine the colon and rectum. 3. The doctor can visually inspect for any abnormalities, polyps or tumors, and may take biopsies if necessary. Imaging tests. In cases where colonoscopy is not feasible or for additional evaluation, imaging tests may be used. 4. These tests can include CT colonography, virtual colonoscopy, intestinal ultrasound, or other imaging methods of the abdominal region. 5. Biopsy and pathology examination. Tissue samples, biopsies, obtained during colonoscopy are examined by a pathologist. 5. This examination helps determine the presence of cancer cells and the type of cancer. 6. Blood tests. While not specific for colon cancer diagnosis, certain blood tests like cancer markers or complete blood count, CBC, may sometimes be used. What is colonoscopy? Colonoscopy is a medical procedure used to examine the inside of the colon, large intestine, and rectum. It involves using a long flexible tube with a camera and light at its tip, called a colonoscope, to visualize the lining of the colon and identify any abnormalities. Why is colonoscopy performed? Colonoscopy is performed for several reasons. 1. 1. Screening for colon cancer. It is commonly used for routine screening to detect and prevent colon cancer by identifying precancerous polyps or early-stage cancers. 2. Diagnosis of symptoms. If a person experiences symptoms like abdominal pain, rectal bleeding, changes in bowel habits, or unexplained weight loss, colonoscopy can help diagnose the underlying cause. 3. Monitoring and surveillance. Patients with a history of colon polyps or colon cancer may undergo periodic colonoscopies to monitor for recurrence or new polyp growth. How is colonoscopy performed? During a colonoscopy, 1. Preparation. Before the procedure, the patient is required to follow a special diet and take laxatives to cleanse the colon thoroughly. This ensures that the colonoscope can visualize the colon lining clearly. Procedure. The patient lies on their side on an examination table. The colonoscope is gently inserted through the anus and advanced slowly along the entire length of the colon. The camera on the colonoscope transmits images to a monitor, allowing the doctor to examine the colon lining. Biopsy or polyp removal. If abnormal tissue such as a polyp is detected, the doctor may perform a biopsy, remove a small sample of tissue, or remove the polyp for further evaluation. Patient comfort. The procedure is usually performed under sedation or anesthesia to minimize discomfort. Most patients do not feel pain during the colonoscopy. How long does colonoscopy take? The duration of a colonoscopy can vary, but typically lasts between 30 minutes to an hour, depending on factors such as the condition of the colon, presence of polyps, and any necessary interventions during the procedure. After the colonoscopy, patients are monitored until the effects of sedation wear off. They may experience mild bloating or gas due to the air introduced into the colon during the procedure. Most patients can resume normal activities within a day. Colonoscopy is a safe and effective procedure for detecting and preventing colon cancer. It is important to follow your doctor's recommendations for screening and discuss any concerns or questions you have about the procedure. What are polyps that can turn into colon cancer? In colon cancer, a polyp is a small benign growth that forms on the inner surface of the colon or rectum. Polyps are typically asymptomatic and are often detected incidentally during screening or colonoscopy. However, some polyps can develop into cancer over time, so diagnosing and treating polyps is important. Colon polyps can be of different types, with the most common being adenomatous polyps. These are the most common type of polyps and carry a risk of developing into cancer. They are considered precursors to colorectal cancer. Hyperplastic polyps. These polyps are generally small and benign, and they rarely progress to cancer. Serrated polyps. Although less common, these polyps have the potential to progress to cancer. Polyps are typically visualized and removed during a colonoscopy procedure. The removed polyps are examined in a pathology laboratory to assess their characteristics. Polyps play a significant role in colon cancer screening because early detection and removal can help prevent colon cancer. Colon cancer survival? The life expectancy for someone diagnosed with colon cancer can vary significantly depending on various factors. Therefore, it's challenging to provide a precise answer about how long someone with colon cancer might live. Factors that can influence life expectancy include the stage of cancer at diagnosis, how well the cancer responds to treatment, the specific treatment options chosen, and the overall health and age of the individual. Many people diagnosed with colon cancer are identified at an early stage and can be successfully treated with surgery, chemotherapy, or other interventions. Early detection and appropriate treatment can lead to complete remission and a normal life expectancy for many individuals. However, if cancer is diagnosed at a later stage or does not respond well to treatment, the prognosis may be less favorable. It's important to note that life expectancy varies for each individual case, and it's best to discuss specific prognosis and treatment options with a qualified healthcare provider specializing in colon cancer. They can provide the most accurate information based on the individual's circumstances and medical history. What are the stages of colon cancer? Colon cancer has different stages to classify the extent and spread of the disease. The stages are typically numbered from 0 to IV. Here are the general characteristics of these stages. 1. Stage XO carcinoma in situ. 1. Cancer cells are found only in the inner lining of the colon and have not spread into the deeper layers or surrounding tissues. 2. At this stage, cancer cells are still localized and have not spread to nearby tissues or lymph nodes. 1. Stage 1. Cancer cells have invaded the inner lining, mucosa, and reached the submucosa. There is no spread to nearby lymph nodes. Stage Y usually indicates early stage cancer. 2. Stage 2. Cancer has spread into the muscle layer of the colon wall, muscularis propria, or deeper tissues. There may be no or minimal spread to nearby lymph nodes. 3. Stage 3. Cancer has penetrated through the colon wall and spread to nearby lymph nodes. In this stage, cancer has reached the lymph nodes, but has not spread to distant organs like the liver or lungs. 4. Stage 4. Cancer has metastasized to distant organs, such as the liver, lungs, brain, bones. At this stage, cancer is typically more advanced and has spread extensively. Staging of colon cancer is important for determining the treatment approach and assessing the prognosis of the patient. Colon cancer detected in early stages can often be treated more successfully, whereas cancers diagnosed at advanced stages may be more challenging to treat. The staging and treatment plan for each patient should be tailored based on the specific characteristics of the cancer and the overall health of the individual. The importance of being informed about colon cancer cannot be overstated. By sharing this knowledge with your circle, you can contribute to raising awareness. If you found this video helpful and informative, please remember to like, share, and subscribe to our channel. Don't forget to turn on notifications so you won't miss our future videos. Wishing you all healthy days ahead.